Thanks everybody for coming tonight. I know that we were here a few hours ago to talk a little bit about some of the national issues related to the H1N1 swine flu influenza. And tonight we were notified by the Washington State Department of Health's Public Health Laboratory that there are 3 counties in Washington with a combined total of 5 cases of what they're calling probable swine flu influenza. And we'll talk a little bit more about what the word probable means and what that means for us as a health district where our primary goal is to reduce the spread of disease. So the 3 counties are King County with 2, Snohomish County with 2, and Spokane County with 1. And, right now we're just learning some of this information. We know that the person who had the lab tests done was tested for influenza. It's a man in his 40s in Spokane. And those samples were sent from the medical system, the traditional medical system here in Spokane, to our state lab for testing. Our state lab ran 2 tests, identical tests, to determine if they could see which type of influenza it was. It is an influenza A virus, but beyond that, they cannot determine the exact strain. Our state lab right now does not have the testing capacity to test for swine influenza. And so the test results from our probable case, as well as the other 2 counties' cases, are being sent to the Centers for Disease Control and Prevention for what's the final test, whether these are swine flu cases. What we do know is that right now the CDC is letting us know that about 95% of the cases that the states are forwarding on to the CDC are coming back as positive for the H1N1 swine flu. So what that means for us is that we must treat this as though this is a confirmed case. And the reason is that if we wait the several days for the CDC to confirm the case, that makes us lose our window of opportunity to try to control it better if it is a case. So because we have the strong likelihood that this is a case, and because we have a short window of opportunity, we will be, as will the other 2 counties and the state, be treating this as though this is a confirmed case. The issue right now is, so what do we do? And what do we do right now is we're asking people who have fever, cough, other sorts of mostly just respiratory and fever, body aches, maybe diarrhea and vomiting that go with that cough and fever. We're asking those people to stay home, whether it's children, whether it's parents, whether it's people who should be or feel like they should be going to work. Right now, we really need everyone who has an illness that's compatible with influenza to be staying at home. Now, we know this is going to be stressful and difficult because people need to be going to school, people need to be going to work, and we understand that this is going to be a difficult time. But if we don't have cooperation with these recommendations, that is how it could spread, and our community would be faced, if this is a case of swine flu, we would be faced with a larger outbreak. So tonight we are asking people to keep kids and parents home if you're ill. We have, several days ago when we first heard about this over the weekend, we did activate our health district's public health emergency response plan, and in particular our pandemic plan. We've been working with our partners over the last couple of days just to make sure that our community partners law enforcement, the medical community, emergency response communities are aware of this, of what might be unfolding, so that as the situation changes, everybody knows what's going on and how we're going to work together and how our plans call for us to be addressing this situation. We will be activating a public information line, and we'll be putting that into effect tomorrow morning at 10 a.m. We need to get it up and operational, so the phone number will not be operational until 10 a.m. And I'm going to give you that number, and I'm also going to give you the number for the Centers for Disease Control. They also have a phone information system. So I'll give you that now verbally, and then I will also give this to you in writing at the end. At the end of my statement, I'll be opening up for questions, both sort of general questions, as well as if you have some scientific questions about what this virus is, how it spreads, what the potential risk is. You'll have a chance to talk to our epidemiologist, who specializes in infectious diseases and has been working on pandemic planning for about 5 years. So our information line for the health district, the number is 866-800-4950. And the CDC has a 24-hour line, which might be more convenient for people, because right now our line is really only available from about 10 in the morning till 7 p.m. So if people can't make that work, then I'm sorry, I've just been told it's only open till 6 p.m. If people can't accommodate that into their schedule, the CDC's 24-hour line might be more convenient. And it is 800-CDC-INFO, I-N-F-O. So what we know right now is this is a disease that's spreading from human to human. At this point, there is no known risk from animals or from poultry, or from pork products or anything like that. This is a human-to-human disease at this point. And again, that's why we're recommending people to be staying home if they're sick. Other simple things that people can do to reduce the spread of diseases like this influenza and other respiratory diseases are to cover your cough and your sneezes with your sleeve or your shoulder. So this kind of a thing versus your hands, because what happens is if you sneeze in or cough in your hands, then you shake someone else's hand, you touch a surface, somebody else picks that germ up and maybe rubs their eye, puts it in their nose, or eats something with it on their fingers. That's how it can spread, as well as the direct coughing or sneezing method. One thing to remember is that this situation we're just learning about, as well as we know that it's unfolding around the nation. We cannot predict with any certainty how this will unfold. So we need to treat this as though it's going to progress in the way that brand new influenza strains that affect humans can progress. So we will be taking this seriously. You're likely to be hearing more recommendations from us as we learn more. At this time, we're not recommending any closures of events, including Bloomsday. We'll be meeting in the morning to discuss this new information about our probable case, to see if we need to change any recommendations, and we'll be letting you know as soon as we've made some decisions. That same thing holds true with schools. We're not recommending any school closures or anything like that at this point, but as the situation changes, so might our advice.